The second phase of the Presidential Committee on the Northeast Initiative Emergency Medical Intervention Program took place in Gombe State from the 15th to the 28th of July 2018. In partnership with ProHealth International, the Pcni free healthcare outreach was also supported by the University of Abuja Teaching Hospital, the West African College of Surgeons, Wipe Your Tears Foundation, and the Gombe State Government. Aptly tagged the Jewel in the Savannah, the picturesque town of Kaltungo in the south and Gombe town in the central were selected as the beneficiary locations for the 2 weeks outreach in Gombe State. Kaltungo is known worldwide as the snake capital of Nigeria due to the high incidence of bites by poisonous snakes. The medical intervention was timely and welcomed as the Presidential Committee on the Northeast Initiative procured and distributed thousands of vials of anti-snake venom. In both the General Hospital in Kaltungo and the Specialist Hospital in Gombe town, the patients trooped out in large numbers on a daily basis to access the much-needed, available and free healthcare services. Treatment cards were distributed on a first-come, first-served basis to the men, women and children. Once they received their treatment cards, the patients passed through the triaging team of nurses, where their vital signs were taken, measured, and recorded. They were then sent to the consulting unit, where doctors attended to them on a one-on-one basis. A total of 6,044 patients were seen by the team of consulting doctors. Many of the patients, after seeing their doctor, went directly to the pharmacy, where their prescribed drugs were dispensed to them. Other patients who needed further investigations were sent to the laboratory. A total of 1,884 patients passed through the laboratory unit, and a total of 5,548 laboratory investigations were carried out. This helped in accurate diagnosis of the ailments and ensured that the correct medication was prescribed. Malnutrition continues to be a big challenge in the Northeast. With Gombe State being relatively safe, there has been an influx of internally displaced persons as a result of the continuing but reduced insurgency in other neighboring states in the Northeast. Nutritional and health education was given to mainly the mothers and other care providers. Nutritional supplements were also given to the malnourished children. The nutritional unit, apart from working in the hospitals, paid visits to some of the secondary schools in the localities, where they carried out focus group discussions, aid and audience-specific health talks with the students. Medical supplies and hygienic kits were also distributed to the schools. The dental team, consisting of dental surgeons, dental technicians, and dental therapists, carried out dental health education, scaling and polishing, dental extractions and denture fixations. A total of 874 patients were treated by the dental team, who carried out 3,219 procedures. Restoring confidence and putting smiles on the patients brought a lot of joy to the team. The team of optometrists and ophthalmic nurses treated 1,780 individual patients after eye tests and refractions, and gave out 699 pairs of glasses. The team of ophthalmologists performed 316 eye surgeries. The joy of regaining sight for many of the patients was truly unquantifiable. In partnership with the University of Abuja Teaching Hospital, the West African College of Surgeons, and the surgeons in the host hospitals, the surgical team, by performing 348 surgeries, set a new outreach record. The surgeries done included post-accident repair of the oral cavity and face, hydrocelectomies, lumpectomies, myomectomies, vaginal and abdominal hysterectomies, thyroidectomies, prostatectomies, bowel resection and anastomosis for typhoid perforation and emergency cesarean sections.
Just open eye.
The highlight of the Gombe outreach was the large number of children that benefited from the program because of the pediatric surgeon that volunteered. The Gombe state government significantly supported the outreaches. The representatives of His Excellency, the Executive Governor of Gombe State, the Commissioner for Health, Dr. Kennedy Isaka, the Permanent Secretary in the Ministry, the Director of Health Services, and other officials of the Ministry of Health visited the hospitals, encouraged the patients, and commended the work being done by the volunteer team.
I'm satisfied. The turnout is quite good. It shows that our people still are conscious of health needs, and they are prepared to come whenever there's an invitation to come for medical services. I'm satisfied with the arrangement by the community, how the whole structure is set up, and how patients move smoothly from one station to the other.
The General T. White Njooma-led Presidential Committee on the Northeast Initiative, PCNI, was represented by Dr. Sidi Ali Mohammed, the head of Humanitarian Assistance, Rehabilitation, and Resettlement. After touring the hospital, interacting with the patients, volunteers, and staff, he had this to say.
Having gone around all the departments, I must sincerely say that I'm highly satisfied with what I've seen so far. And I think it has been a tremendous improvement, on the previous exercises. And I pray and hope that going forward, we should see more and more improvement.
The May Kaltungo, Engineer Saleh Muhammadu, OON, Major General A.K. Kwaskebe, and other prominent citizens of Kaltungo hosted the team to a sumptuous dinner reception. The patients and their relations were full of gratitude to the President of the Federal Republic of Nigeria, General Muhammadu Buhari, the General T. White Njooma-led Presidential Committee on the Northeast Initiative, Gombe State Government, the volunteers from the University of Abuja Teaching Hospital, West African College of Surgeons, Pro Health International, staff of the hospital, and Wipe Your Tears Foundation.
Kawo jinya jika amma tiyata kuma yayi kyau, alhamdulillah yaro ya samu sauki. Mun gode Allah saka maka da alherinsa, Allah kaɗe maka hau da tsautsayi da asara, Allah kare ka, Allah sa mu shika da imani da kalmar shahada, Allah rufa maka asiri, rufa mana gaba ɗaya.
All in all, A total of 10,217 patients were treated during the 2 weeks emergency medical intervention program of PCNI in Gombe State.